Hello, my name is Mrinalini Dey. I am a clinical research fellow and fellow in training in rheumatology and general internal medicine in King's College London in the UK. I am in Vienna for Eular 2024, and today is day one. And actually, today I'm delighted to share a piece of work which I will be presenting later in the conference on Friday during a poster tour. And this is POS 0309. And this abstract is looking at understanding the psychosocial determinants of health in people with rheumatoid arthritis. And this is actually a qualitative study. So why did we feel that this work is needed and why it's important? So there is increasing evidence that social determinants of health have a great impact on the outcomes of people with various chronic diseases, including rheumatoid arthritis. And much of this work has been done in important observational studies as well as smaller qualitative studies. What we aimed to do was gather in-depth patient perspectives on psychological and social factors that drive specifically persistently active disease in rheumatoid arthritis to help us to try and understand the factors that may be contributing to this and try and optimize patient care. So we worked together with patient research partners in order to develop a semi-structured interview in order to gain these perspectives from patients. And then following some pilot interviews, we conducted the final interviews and focus groups with 45 patients in total. And what we were able to find, first of all, we were very lucky and privileged to have a very diverse group of patients take part, and particularly for those of you who are able to read the abstract and join me on Friday, we have a very ethnically diverse population, approximately 50% Caucasian, and then other ethnic minorities as well, making up the rest of the cohort. We specifically found that 47% of patients self-reported that their RA symptoms were not under control at the time of doing the interview. But 96% of patients had attended their rheumatology clinic less than 6 months prior to participating in our study. So what did we find? Well, through doing these in-depth interviews and running thematic analysis, we were able to extract 6 main themes on psychosocial factors that may impact RA management and drive persistently active disease. And these were identified from various barriers and facilitators that we were able to identify from talking to these patients. And so the main themes that we managed to find included aspects such as health literacy, patient education, impacts on work, and there were various other ones which you can see if you come along and look at the poster on Friday. Why does this all matter? Well, we're first of all going to take all of these results and use them to inform a large survey-based study, which we'll then use for a larger epidemiological analysis later in the year. So watch this space for results of that. And also, all of this work can help to guide aspects of care such as social care policies, resource allocation, and just trying to understand what it is that we can do for these patients with refractory and persistently active disease in order to try and give them a more holistic care and management alongside their pharmacological therapy. So as I said, if you'd like to know more, do come and join me on the poster tour at 11 o'clock. On Friday. And for up-to-date information from across the conference, do make sure you keep up to date with RheumNow at rheumnow.com. Thank you.